We are going to show you a precision treatment of the lips. Patient has had lip filler before and she's lost some. After 6 months, it starts to go away and it's a little uneven. So we are going to do a precision lip enhancement on her right now. And we are going to use back-filled Comfortox syringes with the filler of your choice. In her case here, Juvederm Ultra Plus. And we are going to start. What's the point of this? Precision, precision, precision. I can place this filler very precisely exactly where I want it. And because you saw this side, her right side, which is on the left side of your screen, was the deficient side, that's where we're starting. And so we just started with just a little bit in that Cupid's bow, straight down starting right at the vermilion border and going down. And look how it raised that up a little bit. And again, we are going to go slow and easy, and the precision of not having to go ahead and volumize the entire lip. She doesn't need that because she still has a lot of filler in there, but we are going to go ahead and just do a lip enhancement, really an enhancement on just parts of her lip. And that's the beauty of using a back-filled Comfortox syringe, being able to deliver this exactly where we want it. As you can see, the right side of her was deficient, the left side of your screen, but now we're going to add some to the other side just to go ahead and start to match this up. We're not using a lot of filler here because she doesn't need a lot of filler. She still has most of the filler left in there, even though it's been about 6 months, but it did start to wear off and start to dissolve just naturally, because these are 6-month fillers. It started to dissolve unevenly, so we're just going back and adding where we need it there. So here you see we are starting in front of the vermilion border because we are just looking at her in a 3D manner to really determine where does she need the volume, where does she need the lip height, because going in at this right angle technique is going to give us the lip height. And as you saw when we started this lip enhancement, she was definitely deficient there. And now here's the trick to great AAFE results, and that is lip smoothing. You can manipulate that filler. Look how even that looks now, and that is fantastic. You want to go exactly to where you need it, nowhere else. What you see is what you get. You don't have to overfill it or anything like that. So go ahead, put it in there, let it sit for a little bit. Keep taking a look at it from different angles on the patient. Make sure that you are going to get a great result. We still need to lift up that Cupid's bow, but now we're going to add a little volume right underneath it there. And again, because we're using a Comfortox syringe, you can be much more precise than with the needle and the syringe that the filler actually comes in with. We use sterile technique to backfill the Comfortox syringe, as we've shown you many times in the AAFE courses, or you can check out our social media channels as well. Now we're going to go a little bit closer to the vermilion border because we need to pop up and support that vermilion border to really even it out to the other side. And you can see, slow but sure, let the filler sit there a little bit, absorb a little bit of water. Yes, it will bleed a little bit, and that's all just fine here. Now we take a look at the other side. We want a little support under that Cupid's bow. So we are going to go in very close to the vermilion border. Again, this is fairly shallow because you've got to know where the vasculature is, and we have ultrasounded her lips in the past to get some imaging, so we know her anatomy quite well, and that's an important point to this too. Just going to go along the vermilion border, just pop it out, roll it out just a little bit to match both sides, and use your fingers to manipulate it. That's how you get some really great results. Some initial swelling you'll see here, but the patient is doing great. And that swelling, as you know, will go away in very short period of time here as well. But again, take your time with this, because every time you inject a little bit of filler, don't forget, it's going to absorb some water. Then you get to see in a few minutes a better result, what the result really is, and if you really are on target here. So now we're going to go to the lower lip on that right side, which was also a little bit more deficient as this filler was naturally wearing off at the 6-month point. But again, this can last even longer here, and that is really part of the magic of placing these fillers in here. Nice and slow, put it exactly where you want it. With this, we can just use any syringe, and now we are going to clean off the patient really, really well. Don't use a lot of force here. You can manipulate it with your fingers, but here, just cleaning it off, you don't want to move it around. When you have it exactly right, and that's exactly right where we want it right now, that's exactly what you need. So don't do too much. Many times people do some smoothing, and that's what we want. We've showed you that before. But if you're too forceful on it, you can actually bruise the patient and move things to where you don't want it to go. Now get the patient up, look from different angles, and we know that the patient's going to be pleased, giving a smile, but a little bit numb, so it's hard to get the real sense of that. But we'll see in about an hour where this patient is, and she looks absolutely great. Now let's take a look at the before and afters, and you can see on top is the before, that deficient right side of her lip, and taken care of on the bottom, and you can see we'll show you different angles here. Beautiful, beautiful result. That is a precision lip enhancement. Doesn't need a full lip enhancement here, just precision to bring it back up to where it was before, and the patient will do very well with this going forward here. So you can learn to do this too. Time for you to learn how to do this, and for you to get AAFE certification trained on lips. Here you can see the full face post lip enhancement, post the botulinum toxin treatment. She looks just great. You've got to learn to do all of this treatment. Add it to your practice today. Time for you to get AAFE certification trained today.